We are live, sir. Good evening, doctors. Thank you so much for coming in huge numbers. Dear doctors, please note, you can make sure you can hear my voice clearly and you can see the shared screen, which is on your screens right now. Doctors, please note, all candidates who want to claim certificates of participation should have enrolled for this program. So make sure you go to the website and enroll yourself for this program. Mere registration won't get you the certificate. You will have to enroll for the program specifically. It's absolutely free. You can visit www.onlinedentistry.in and enroll for this program. Thank you, doctors, for logging in early, that too on a Sunday night. We are glad that you're here. We are just waiting for all the candidates to log in. Please bear with us.
लड़ाई शुरू कर दी। वो 9 साल से उनके साथ लड़ाई कर रहा था, पर एक भी लड़ाई नहीं। तो
Sorry for the disturbance, doctors. It's 8:05, doctors. We can start with the program today. Good evening, doctors, and welcome once again to the free lockdown webinar. Thank you so much for logging in at this point of time, that is 8 o'clock on a Sunday night. Talk about online dentistry. Online dentistry, our motto is to redefine dental education, to which we have been striving towards for the past 13 years and have made sure that it has happened. Taking a look at the number and the statistics of this institution, we were established in 2008. We have completed a total number of 122 offline courses and another 350 courses that were conducted online during this lockdown. Our platforms altogether have 13,500 followers until today. Moving on to the backbone, the founder and CEO, Dr. Binu T. Abraham, is an orthodontist by profession, a passionate photographer. He is an international speaker and has been the speaker for ISPPD for the last 6 years. He is a teacher who helps clinicians understand and assimilate the clinically significant concepts that they can implement in their practice the very next day. Next, we have the co-founder and head of academics, Professor Dr. Joby Peter. Sir is the professor and head of department in the Department of Pediatric and Preventive Dentistry, Malabar Dental College and Research Center. Sir preaches and practices the philosophy of catch them young and watch them grow. Online dentistry at present has 10 centers across India. You name the primary city, we have there. But at present, we have suspended all the offline courses due to the pandemic. But there's a good news, we'll be resuming soon as and when the authorities permit us. Now coming to the types of webinar we conduct, we have primarily two sorts of webinar. One is the free webinar, which spans for 1 hour and is power-packed with information. This is just like the one that you're attending right now. All candidates participating who are enrolled for the program are eligible for free certificates of participation and at times free goodies too. The other kind of webinar that we have is a paid webinar, which lasts between 3 to 5 hours. It is a 1 full day program, which will award the candidate a certificate of participation, extensive discussion and virtual hands-on, and also a post-class support WhatsApp group through which they can discuss their cases and have solutions. The upcoming free programs are on the topics dental crowding and its early management, coming up on 7 February 2021, and sectional orthodontics for your pediatric practices, coming up on 7 March 2021. The paid programs, one was all about caries management, which happened today. It was an extensive session, and I can see many of the participants who are still here to attend the free program also. Then up next, on 28 February, we'll be having non-extraction management of crowding. And in March, the program that will come up on paid program is sectional orthodontics for your pediatric cases. Now, if you have any doubts, feel free to contact us via WhatsApp on the above two numbers, that is 98470-32032 and 94463-21220. You can also contact us in the contact us section on the website www.onlinedentistry.in. Now over to the speaker of the day, Dr. Binu T. Abraham. Binu sir, over to you, sir.
Thank you very much, Joe. Can you stop your share so that I can start mine? My slide visible, Joe?
Yes, sir.
Can I start?
Sure, sir.
All right. Good evening, one and all. Guys, please come in video. I always tell that. If it's okay, yeah, it's not mandatory. If it's okay, please come in video so that I can see some faces. And oh, there are people who are there with us whole 9 hours. Still here. Dr. Tina, there are people who attended full 9 hours, just now completed. Dr. Nisha, thank you so much. I can see Tarian sir here. Thank you so much, sir, for coming in. Aishwarya Menon was there whole 9 hours. Hectic session by Dr. Jobby on caries management. One of its kind program ever attempted. Any continuing dental education people. We are proud that we could do that successfully. Thank you so much for the support shown. Little less than 100 people, 93 or 94 people registered for the caries program. Because everybody think that caries is something which everybody knows. Yeah, what is more to learn on caries? But I think the concept was completely changed today in the last 9-hour session, which ended hardly 30 minutes before. So thank you all for coming in at this time for this session. A family was having lunch together when suddenly the bell rang. The bell rang. So the lady of the house decided to go out and see who it is, opened the door. The lady of the house opened the door. When she opened the door, the three gentlemen standing outside, and the name of the three gentlemen, Mr. Love, Mr. Wealth, and Mr. Success. Come on, these things come in WhatsApp. Yeah, because of this WhatsApp, I cannot have any more good introductory opening slides anymore because of WhatsApp. Mr. Love, Mr. Wealth, and Mr. Success standing outside, and the typical statement is only one person can come in. So choose which one you want, Mr. Love, Mr. Wealth, or Mr. Success. So this lady went inside and had a discussion with husband and kid, and husband obviously said, well, Dave, get that Wealth guy to come in. And then she said, I think I should invite Success inside, not Wealth. And then that cute little kid sitting in the middle said, Dada, Mama, why don't we invite Love inside to this house? So this lady decided, yeah, let's do that. Let's go invite Love into this house. So went out and said, one guy can come in, that's Mr. Love. So Mr. Love very happily came inside. But interestingly, when Mr. Love came inside, the other three followed. What does that mean? It means that if you invite Love into your house, Success and Wealth will just follow. It's the same thing in dentistry, guys. For private practice, this is for private practitioners, private practice, if you enjoy dentistry, if you enjoy what you're doing, guys, that passion, that enjoyment, that love is directly proportional to wealth and success. Enjoy what you're doing. Don't be just a repair center. Sir, there's a cavity here, just fill it and leave. No. Be a healing center. That was the bottom line of Dr. Jobby's 9-hour session that happened today on caries management. Be a healing center, not just a repair center where you just repair their problem and stop right there. No. Talk to them. Keep talking to them. Everything going on in their family. Talk about their son, their grandson. They'll be so happy if you discuss all that. Enjoy what you are doing. Love it. The ones that is there, wealth and success will follow. With that, let me go into a topic which is not taken much in our platform, but it is, yeah, in a way it is taken in our platform also. That is disturbed sleep. Disturbed sleep and its 7 clinical indicators a dentist should know. Now, we are dentists. Patients coming with pain. I'm doing root canals. I'm doing beautiful crowns. Why should I worry about sleep and all that? Yeah, come on. Guys, please be open-minded. As I told you, enjoy what you're doing. Rest too will follow. 7 clinical indicators a dentist should know of a person who is a mouth breather or who is a disturbed sleeper. Extraoral feature, there are 3 extraoral features which I'm trying to cover here. Feature number 1 is long face. The moment you see a long face of a patient, now, how do you know whether it's a long face? To know that it is a long face, you have to have an idea, you have to have a follow-up. 3 months before, when I met this female, it was not like this. Now, I feel there is something wrong in the way she is growing. For that, you have to have some basic knowledge. You have to know the basic length of the face. You have to have some basic idea of cephalometrics. Little bit of learning. You don't have to be an orthodontist, please. Every general dentist should know about posterior facial height, anterior facial height. Just the distance between these 2 points, guys. Anybody can measure. Measure it. Posterior height divided by anterior height multiplied by 100 will give you a percentage. If it's less than 62%, we are talking about a vertical grower. Many will be thinking now, what is this fellow talking about? Vertical growth. And I have my orthodontist taking care of all that. Guys, it's your duty as the owner of a clinic to understand what is going on with every patient. Do not depend on your specialist for everything. You should be having basic knowledge. And to get these 2 values and to get a percentage, you don't need an MDS. All you need is a mind change. Mind change towards dentistry. Enjoy dentistry. And all that typical brachycephalic, mesocephalic, dolichocephalic, all that big names. No big deal. Long face, short face, and medium face. You have to have some basic idea. The moment you see that this kid is having a longer face than normal, watch out. Why don't you tell the parents? Why don't you tell the parents? See, I've done the fillings, I've done the fluorides, I've done the fillings, but let me tell you something. I have noticed that your kid is growing vertically a little longer than normal. Some patients may not like it. I feel it's growing little more than normal. Is it because is your daughter a mouth breather or something? Parents might say, oh yeah, we know that. We know. She's a mouth breather. She opens her mouth like horse. But doctor, don't worry about it. My uncle is a very famous ENT guy in this. And you don't know him? You don't know Mr. So-and-so ENT? Oh, no, I don't know. Sorry. It's okay. So they're taking care of that, it seems, according to them. But you said something so valid. You just pointed out something so important to them that their kid is a mouth breather. And that so-called uncle, the ENT famous surgeon, might have told that it's okay, by the age of 11 year, 12 year, the adenoids will come down, he will become normal, she will become normal. That's what the so-called famous ENT told. It is your responsibility to make them aware about what is happening. Long face. Secondly, retruded mandible. The moment you see that the mandible is going back, note it down, tell your patients. Do not hesitate to tell. Don't think, what will they think when I say? Let them think whatever they want. You tell what is scientific and evidence-based. Mandible is behind. retrognathic mandible. Tell the father and mother, in front of the father and mother, tell the kid to bring the mandible forward a little, show them the difference. Show them the difference from the side view, front view. The moment they bring the mandible forward like that, the mother says, hey, now she looks like me. I was wondering why she never looked like me. I was so pretty when I was young. My daughter is not like that, it seems. I've heard all that. Make them aware about what's going on. They may not like it. As I told you earlier, they may not like it, doctor. You don't worry about all that. You just do the fillings, you just do the fluoride or whatever. But you tell what you think is genuine. Point number 3, nasal hump. Has anybody noticed the nasal hump on your patient? Big nasal humps can happen just because you are a mouth breather. The moment you are a mouth breather, you have a narrow maxilla. Maxilla constricts. And the maxilla constricts, the whole nasal assembly constricts, and you can see a hump here. So just by seeing that nasal hump, you can give a warning to the parents. Hey, is your son a mouth breather? I think he's a mouth breather. At like 2 a.m., 3 a.m. Don't worry. Just tell whatever you feel is genuine. So, nasal hump. So I just covered 3 extraoral features. Whenever you see a long face, retruded mandible, and nasal hump. There are so many more. There's no time for all that. You see these features, understand that there's something wrong going on. Explain to them. Coming to intraoral features. Intraoral features, we are talking about open bite. You are doing a filling, you're doing a stainless steel crown, you're doing a lot of work on the kid, and you noticed that there is no overjet. I mean, overbite. There's no overbite. It's pretty much edge to edge. You noticed it. 3 months later, the patient came to you. You found that it's become wider again. 3 months later, the patient came again. It's become wider again. Parents might tell you on face, doctor, there is some problem with the way the face is going. Don't worry about it. I have done my fluorides. I have done my fillings. Don't worry about it. We can deal it at the age of 13 years with an orthodontist or whatever. Guys, don't be so negligent. Times have changed. People might ask you on face, sir, I read somewhere that we have to deal with this early. If the kid has an open bite at the age of 7 years, it is never, ever going to solve by itself. It is only going to worsen. Please help them understand that about open bite. Constricted upper arch. Last visit, you notice that the premolars are going in a little here and there. Next visit, you can see premolars are going in more. Next visit, premolars are completely in, anteriors are crowded. And next visit, you had it completely inside. But still, you are doing your fillings. You are doing your complete restorative treatments, neglecting this stuff. Constricted upper arch. While doing fillings, while doing fluorides, why can't you check the intermolar, interpremolar width? Why can't you have an analysis of that? It will only take 2 to 3 minutes more in your practice. Find out the intermolar width. Explain to the parents. They may not understand. They may not accept. They may not agree with you. They might argue with you. Doctor, you don't worry about all that. My father, my grandfather was like that. I know. You don't worry about it. Do the filling and leave me. Their attitude might be like that, but just tell them. Just tell them. Increased palatal depth. Huge palatal depth. For that, to identify that and you get a measurement, you might require a cast for that. Many may not even allow to take an impression and a cast, because why are you taking an impression? I just came for a filling. He had pain, this, that. Yeah, just take the palatal depth. If the palatal depth is too much, what is it indicating? The tongue is not there. Tongue has to be up there, not down. The moment this tongue is down, the buccinators take over, masseters take over, and you can see the arch compressing because the tongue pressure is zero, because tongue posture is low. Explain that to the parents. Lastly, enlarged tonsils. Very controversial. You tell the parents, see, your son has such a big tonsil. We call it kissing tonsils. Please do something about it. Doctor, don't worry about it. We are under the treatment of one of the best homeopathic doctor in the country. Okay, God bless. Guys, you tell what you... The homeopathic guy or the ENT or the Ayurvedic or whatever, no offenses here, they are looking at one and only one thing. Is that tonsil getting recurrent infections? Is that kid having recurrent infections? They are not looking at the growing pattern. They are not looking at the vertical. They are not looking at the constricted arch. They are not looking at the open bite. They are looking at nothing. They are only looking at one thing. Is the kid having recurrent infections? See, with my treatment, he's not having any cough, cold, nothing for the last 3 months. Successful. He can even eat ice cream now. Successful. They are not looking at the daily growing pattern of the kid. They are not looking at the mouth breathing, the sleeping pattern of the kid. This is what I want to convey here. The importance of sleep, the importance of sleeping properly of a kid or an adult, importance of sleeping properly. Quickly, let me recap what I just now said. 3 extraoral feature: long face, retruded mandible, and nose hump. There are many more, yeah? There are many more extraoral and there are many more intraoral. But I don't have time for all that. Tonsils, this, that. When you say tonsils, you can take a lateral stuff and you look at adenoid. There are many, many, many more. I don't have time for all that. But these indicators which you see in your private practice tomorrow morning, let me tell you, you have a social obligation to explain to the parents what is going on. Whether they like it or not, it's a different story altogether. Whether they accept it or not, it's a different story altogether. You be a holistic dentist. You enjoy what you're doing. You love dentistry. Do not look at money there. Wealth and success will automatically come. This is a 27-year-old guy that came to me with a complaint of long face, gummy smile. I don't like my smile, too much of gum seen and all that. 27-year-old guy. He has all the symptoms of a mouth breather, nasal hump, face, everything is there. I can make his face flatter. I can make his face flatter. But how? I will have to do a orthodontic surgery. He's 27. Wish somebody had told him at the age of 12 or 13 that you are a chronic mouth breather. You have a sleep disturbance going on. Why don't you treat that? But nobody told. He's now ended up in a surgical table. The rest of his life, he has to live with these surgical screws and splints and all that. But he definitely got a better smile. He's happy with that flat smile, gummy smile gone. But he has to live with this. So, what are we talking about? Disturbances in sleep, mouth breathing, oxygen saturation coming down. So what is sleep? Why is sleep so important? Come on, this is dentistry. We are all dentists. Why is this fellow talking about sleep? Yeah, guys, we as online dentistry, in my clinic called Kerala Dental Clinic has a team, and the team has ENT, pediatric dentist, of course, Dr. Joby, ENT, pulmonologist, speech therapist. We are a team working on these kids. Guys, dentistry is way beyond what you think. It's way beyond all the typical fillings what you do. Learn more. Enjoy dentistry. Talk to every parent. Talk to every kid. Talk to every grandparent. Take time. They'll be happy and they will refer more people. Do not do marketing to get more new patients. New patients will automatically come the moment you learn more and the moment you explain to them more. Sleep. Sleep supposed to be the housekeeping of the human body. Housekeeping happens at night when you sleep. Sleep is divided into multiple stages. Here, I would like to, now it's like almost 20 minutes past the lecture. I would like to come to the chat box just to make sure all are still alive here. Come to the chat box and tell me, how is it going? Or how is it going? Answer, I don't know. Can I expect some answer? Good, sir. Shruti Kuttappa has said, good, sir. Yeah. But let me put a question a little more clearer. Stages of sleep. Can somebody come to chat box and tell me the stages of sleep? Non-REM and REM. Perfect. Srinidhi, she has already attended my class. I have seen her name so many times. Pavani, come on, you have attended my sleep. My lecture. Sorry, I just said you have attended my sleep. I said you have just attended my sleep lecture. So REM and no-REM. Yeah, perfect. Stages of sleep. Stages of sleep. Why do we have to know about all this? It is important because only when you know the normalcy, you will understand the abnormalcy. So let's look at the stages. Sleep is divided into non-REM and REM. Non-REM is, REM is what? Rapid eye movement. Non-REM, no rapid eye movement. And REM is rapid eye movement. So the first stage is REM 1, non-REM 1. No rapid eye movement. Stage 1. Stage 1 is wakefulness to sleep. What does that mean? You are like lying down. You kept your mobile away. You took your specs away. You are now ready to sleep. You just lie down. You are like awake. That wakefulness to the sleep. That particular stage is called non-REM 1. And then you have non-REM 2. Non-REM 2 is a light sleep stage. You almost slept. But that's when the calling bell will ring and you just get up immediately. Somehow, when you try to sleep, some phone call, some notification will come. Light sleep stage, you will get up. Non-REM 2. And then there is non-REM 3. Non-REM 3 is a deep sleep stage. Deep sleep stage is very difficult to wake you up. Deep sleep stage, REM, non-REM 3 is a very difficult stage to wake you up. You know what? The thieves know the stages better than we dentists. They know when to intrude into a house. They know when people are sleeping. They know when they are getting into third stage. So deep sleep, non-REM 3. After non-REM 3, you go to rapid eye movement. Once you're in rapid eye movement, that's the time when your pulse rate, everything is actually back to awake stage. Deep Non-REM 3, you are like real low down in your pulse and you're really relaxing. Everything is relaxing. And then the REM stage, and from the REM stage, it goes back to non-REM stage. This cycle continues every 90 minutes in your sleep. This is a cycle that continues every 90 minutes. And interestingly, those bruxers, you understand that bruxism happens between REM 2 and REM 3, just for the bruxers. Mouth breathing can be anytime. Now, why do we have to know all this? Yeah? Come on, tomorrow morning, Monday morning, I'm waiting for my patient to do laminates and veneers and all that. But the life of your laminate, life of your crown depends upon that patient's sleep stages. You better know about it. The moment you see your fillings fracturing again and again, do something called as ESS, Epworth Sleepiness Scale. Have you ever tried ESS on your patient? Guys, I'm openly challenging here. Come to the chat box. Anybody listening to me has tried ESS in your clinic? I'm sure there are some people already into sleep. Dr. Sonia, I saw her name. Sonia from Caribbean Island is already doing complete sleep study in her clinic. I saw her name here, but I think she lost her connection. She's not here. Nobody is doing ESS. ESS is nothing but a simple questionnaire to be given to the patient. The questionnaire is given here. The website. You just, after the lecture, go back to the website and log on to the website and get the questionnaire. Put your clinic name there. Give the questionnaire to the patient. You know what? As a beginning, give the questionnaire to your close friends. Give the questionnaire to your father and mother. Give the questionnaire. Sitting inactive in a public place. Example, waiting room, a theater, or a meeting. Sitting inactive in a public place, the likelihood to fall asleep. Haven't you seen those people sitting and sleeping in the waiting area? Sitting and sleeping in a movie hall when Vijay, by the way, I took the risk of watching Vijay's Master. Why watching Vijay's Master movie if somebody can really sleep? He has a problem, guys. That's such a movie. And look at that. Watching TV, are you sleeping? There's a score for that. Get the score. And if that score is above so and so, it's all there in the website. Go to the website and check all that. Means if you feel that this fellow has a problem, the moment he sits next, you started driving, you have a friend next to you, you went for a drive, you started driving, you said, hey, how are you, buddy? You looked at him, he has already slept there. Immediately slept off. There are people like that. You start watching a movie, you see your friend of yours sleeping already. You know what? Give this sheet your close friends, to your father and mother, I would say. Find out about the ESS. And once ESS is above certain limits, the limits will all come in the articles. I don't want to put all the limits in here in the lecture. If the limits are above certain value, 16, 18, 22, means there is a problem. Now you can refer for PSG. PSG is what? Polysomnogram, sleep study. Oh, dentist telling a patient to go for sleep study? Ridiculous. Guys, it's all happening. There are dental clinics with sleep study center attached. There are dental clinics with Botox treatment attached. There are dental clinics with sleep study center attached. Things are changing, guys. Without going by those changes, please don't complain. There are no patients coming in. It's so sad. There are so many clinics next to me. He's charging only 100 rupees for extraction. So ridiculous, so sad. How will I survive? I have EMIs. Do not complain like that. If you are not updating yourself, just forget about others. You update your stuff, things will come in place. So polysomnogram is sleep study. My God, it has so many leads. It looks at your brain activity, EEG, electroencephalogram, looks at the eye movement, echo-oculogram, looks at your muscular movement, electromyogram. It looks at your heart rate, which is, of course, electrocardiogram, the oronasal flow, the flow part, saturation part, the snoring part, and the report will come like that. Now you send the patient for a PSG, and the report comes like that. Patients, guys, trust you. They come to you, doctor, as you said, I went to the sleep specialist and he said there is a problem. Thank you so much for referring me to the sleep specialist, sir. I never knew I am this bad in my sleep, sir. Sir, this is the report, sir. I would like you also to see the report, sir. I want your comment about the report, sir. Now the report is here. You open the paper. Oh my God, this is a report in front of you. We are dentists, yeah. We can't even read the ECG properly. Now you're talking about PSG report in front of you. They trust you. Haven't you seen patients coming to you with MRI brain? Sir, this is the MRI of my wife. Can you just look at it and comment, sir? I trust what you say, sir. You look at it, you don't even know which angle to put it here. There's nothing written. They don't know which side it is. That ridiculous is a PSG report. What will you do? Guys, please learn a little about PSG. It's not that tough. In this session, quickly, all I'm trying to do is to talk about one part of PSG. What is that one part of PSG? That is about apnea hypopnea index, AHI. The red ones are apneas and the pink ones are hypopneas. Tough, huh? Tough. Never thought Dr. Binu will talk about big stuff. Apnea, hypopnea. Red ones are apneas. What do you mean by apnea? Apnea is complete stop of breathing for more than 10 seconds. This fellow stopped breathing during his sleep. That is apnea. And hypopnea is reduction by 50%. Is okay, but reduction by 50%. Apnea hypopnea index, AHI. Can somebody come to the chat box and quickly tell me the normal value of AHI? What are we talking about? You guys thought I will talk about some orthodontic correction of crowding and arch expansion, all that tonight. Huh? AHI normal value is more than 10 times per hour. 10 times you get an apnea or an hypopnea per hour. There is a problem. There is a problem in your sleeping. So let's come back to this particular patient. Let's look at this patient. How many times do we have here? 1, 2, 3, 4, 5, 6. 6 apneas and 1 hypopnea. That is like 7. So 7 is what? Less than normal. So it's okay. 10, up to 10 is okay, right? Up to 10 per hour. Up to 10 per hour. Now look at the bottom of this sheet here. Look at the bottom of this sheet here. What is the time shown there? In 5 minutes of this fellow's sleep, just 5 minutes of this fellow's sleep, look at his AHI. Look at the amount of apneas and hypopneas that happened in just 5 minutes of this fellow's sleep, guys. 5 minutes. It's not one. It's alarmingly high. He's not sleeping. That is his AHI. And this also shows many other things like the oxygen saturation. If your mouth breather saturation goes down, 80, look at that, 80. Came to 85, came down to 81. Came up again, came down again. Came up again, came down again. So that's a saturation. Snoring. Snoring is there. It's not that tough. PSG report is not that tough. It is just the mindset to learn, mindset to enjoy dentistry. As I told you, love, passion, enjoyment, rest all will follow. This is a normal report here. Look at that, no AHI, everything perfectly normal. Look at the saturation here, 96 all throughout, beautiful saturation. No mouth breathing, no apnea, no hypopnea. So next time, tomorrow you see a sleep study report of one of your patients, please don't be shocked. Let's know at least 2-3 values. You need to know that. Find out the best pulmonologist in your area. Get a connection with him. You need a pulmonologist to go forward in your dental practice. You need an ENT to go forward in your dental practice. You need a speech therapist to go forward. You do a lingual frenectomy, you need a speech therapist to go forward. Please take it down from me. It is multidisciplinary. Do not look at just filling and billing and all that. As Dr. Joby was yelling whole 9 hours today. Filling and billing. It's more than that. With this, I just could cover a little bit about apnea, hypopnea, and the differences. Lastly, about ADHD. What is ADHD? Can somebody come to the chat box and tell me what is ADHD? See, coming to the chat box is just to make sure nobody's sleeping. Simple as that. Tina Sarah Sam has a cute kid sleeping on her. Yeah. Appreciate your dedication. Right from 10:30 a.m. you logged in. Now it's what? Almost 9 p.m. Now that cute little kid, you have agreed to put it here at least. Hats off to the dedication, Dr. Tina. I mean, it needs some dedication. Attention deficit hyperactivity disorder. Yes, ADHD. One of the most neglected, misdiagnosed feature in psychiatry. Any hyperactive kid you take to a psychiatrist or a psychologist will immediately classify it as ADHD. My son, my God, he's so irritating. He just doesn't sit in one place. He breaks everything, this, that. They go to a psychiatrist, give some medicines, the kid sits quietly like that. It's so sad to see your kid sitting quietly in one corner. It feels really sad. I have 2 kids gone through these stages, so I know the one day if they're not active, our feeling is different. We wish they were active. ADHD, one of the most misdiagnosed features. I didn't say that. Dr. Josh Jefferson, one of my close friends and associate in New York University, sir, came out with this article. This article is given in the website. You can go to our website and get this article. With sir's permission, I've given the complete link to the article. Dr. Josh Jefferson's article on mouth breathing and its adverse effects on the facial growth, health, academics and behavior. Academics. The moment you say academics, parents are like, doctor, did you say anything about my son's studying pattern? He's so bad. He's horrible. He gets 0 in all subjects. So the moment you say academics, we have a different attention level altogether. When you told about the intermolar width, the nasal hump, the vertical, they never cared. The moment you say about academics, behavior, now they have something to say. Now they are getting your attention. That article is so good. Read that. Dr. Josh Jefferson corrected so many mouth breathers and avoided ADHD or avoided the drugs for ADHD just by correcting the sleep pattern. In that article, he clearly says the lack of sleep can adversely affect their growth and academic performance. Read that article, guys. It's worth it. So, I'm done. Concluding with the statements what I covered just now. Little bit of features of mouth breather, clinical feature, extraoral, 4 intraoral. There are so many more features you can look at. Sleep and its stages. ESS, Epworth Sleepiness Scale, is so important to talk to your patients. And as I told you, at least talk to your own father and mother, get the scale. See your friend's scale. See that close friend of yours, you go for a trip to Ooty, and then you see this particular fellow is sitting there and sleeping when everybody else is having a campfire. Get that fellow's ESS scale. Go for PSG. And then a little bit about ADHD. And lastly, an assignment for all of you listening to me. One simple assignment. All you have to do is go to Google and type in mouth breather and click enter. The moment you type in mouth breather and click enter, believe me, what you see is a stupid person. Great. I didn't say that. Google said that. Dictionary.com said that. I didn't say that. I don't completely agree with that, to be very frank, because I have IIT graduates who are mouth breathers. But there is a reason why it is said that. Thank you so much for your time. Thank you so much for the big numbers coming in. For the program, which has been repeated multiple times, you guys have come in again. Thank you very much. Over to you, Dr. Joby. Oh, nice to see you, Dr. Joby, after the marathon session, 9 hours. I thought you slept off, Dr. Joby. Thank you so much for coming in.
Yeah, Binu, thank you. Thank you so much, Dr. Binu. Thank you, everyone, for coming in large numbers. If you have any doubts, a wonderful session as usual. He has enlightened us with the mouth breathing and its consequences. I could see a lot of people who were there with us for the entire day are still attending, and I can see some people are even making their child into sleep and attending this session too. Amazing, Dr. Tina. That is a dedication to dentistry that you are doing. Wish you all the best. If you have any more doubts, you can put in the chat box. We had a very hectic session. We just got over. And hats off to Dr. Binu, that the spirit and energy that he has, and he is explained this session too, took care of this session also. So any more doubts? I think there, if you can put in the chat box, please, or you can unmute yourself. It's a small group.
Dr. Joby, I can see Dr. Tarian sir here. I would really love sir come and talk. So my professor in KMC Manipal.
Can you unmute? Binu, I can't see others. Can you unmute?
Sir, Dr. Tarian sir, I have unmuted you. You want to talk, sir?
Binu, this is a refresher course for me from Joby and you. I always enjoy this, and thank you. I just have to say thank you. That's all.
Thank you so much, sir.
It's a great session. Great session.
One of the senior most pediatric dentist, my professor in KMC Manipal. Thank you so much, sir.
Thank you, Binu.
Anybody want to ask any question or anything? If you want to unmute, you can. We can let you. You can just put the any doubts or anything is there. You can just put the thumbs up. We can do. Now, basically, Dr. Binu has just covered the clinical application of science that we can see in our clinical practice. Many times, parents says that my son or daughter opens the mouth and breathe. No, you never see these clinical factors. You just directly go into oral screen. You make appliances. That is our concept. That's not the right way to approach it. You will fail. You will become successful in many, but majority will fail, because we have experienced that after 4 to 5 years, the same patient will come back with that oral screen that you gave. Sir, one dentist told us to give this. We gave, but she didn't wear. that's what Dr. Biru stressed today.
Dr.
So-
Sunil has asked a very important question.
Yes.
How do we go about this? Management of sleep disorder, how do we go about this? Dr. Sunil, the immediate is number one, give them the ESS. Get the ESS score. Once the ESS score is more than like 18, 20, 22, you got to refer to a pulmonologist. But make sure you have a pulmonologist in your team. Just sending a go meet a pulmonologist and come back to me, that doesn't make sense. You got to have somebody in your team, somebody whom you trust, somebody whom you have already talked to. And the pulmonologist to understand that, oh my God, this is not a normal dentist. He knows something more than a normal dentist. That is the kind of approach we need. But they will take care of it. They will take care of the sleep part very well. After the PhD, you get to know exactly what's going wrong. You'll find out the myo part, the muscular part, the cardiac part, the ocular part. With all that, they will find out what exactly is going wrong. And believe me, end of all the sleep study, you might be only asked to put some kind of a mandibular advancement device, MAD, into the mouth. So you get money again there by doing a MAD. You suddenly tell the patient, I would like to put a mandibular advancement device on you, they won't accept it. But they go to a pulmonologist, and the pulmonologist sends it back to you saying that, it's better that you put a mandibular advancement device or a CPAP and all that. So we are now talking about a different level altogether where patient has been made aware about what's going on. Anything else?
Dr. Srinidhi has asked one question. How many times we listen this, our mind says to listen again without getting bored. Thank you so much. It's an appreciation, Dr.
Thank you so much, sir. Thank you so much.
Dr.
That's
Mariam,
really-
Dr. Mariam Ali has asked, we seeing more and more of this. Doing myobrace to correct habit, Dr. Binu, we need a day course. Okay.
To be very frank, we are still working on a 1 full day program on sleep and sleep apnea related to dentistry. Still on the discussion with the pulmonologist and the ENTs and speech therapists and all that. Just not happening, but it will happen. I promise it will happen pretty soon. After 8 months of discussion on caries, we did that today, right? So sleep will also happen pretty soon. Anything else?
Yes, I think pretty stable now. No more questions. Joe, in YouTube, any more questions are there?
No, sir. There are no questions on YouTube, sir.
Perfect.
Fine. Shall we wind up, Dr. Bill? I think all the questions are done.
Dr. Srinidhi said, sir, can we have new topics? Dr. Srinidhi, I am going to put you another question back. Please suggest new topics. It's been a rewarding day. But I suggest hats off to you for that 9 hours of marathon session by Dr. Joby and then sitting. Remember at the end of Dr. Joby's session, I am not compelling anybody to come for this session because I know what you went through, 9 hours of caries management. And then you again sat through this too much.
And that too, it's a totally different topic, and it's a totally different perspective of dentistry is actually. But that is great. Can an adult with a sleep apnea be treated orthodontically?
Oh, that's a very vague question. You have to find the stage of sleep apnea, one. You have to find out the orthodontic problem, number two. So without knowing what exactly is the orthodontic problem, very difficult to comment that. If there is a severe mandibular retrognathis and all that, yeah, you might have to correct that. Even in an adult, you can correct mandibular retrognathis. But it may not be a permanent solution unless it's a surgery. But you can go for CPAPs, MADs. There are so many possibilities available these days to get his sleep corrected, not his retrognathism corrected.
Dr. Srinidhi suggested one topic, distraction osteogenesis.
Great. Great. That is going to happen soon. I had a chat with one of the famous oral surgeons of. See, I'm not going to talk about distractional osteogenesis. No, one of the. See, when I talk about something, it should be something which I do. So I had a talk with one of the famous oral surgeons. I don't want to tell the name here. He has pretty much agreed to come on the topics of distractional osteogenesis, orthognathic surgeries, cleft lip, cleft palate. We are working on it. It will come soon. I promise it will come soon. Anything else?
That's a great news. That's great. Anything else is there?
Okay, I think we can call it a day, Dr. Javi.
Yes,
We had a very productive day, hectic day.
it's 26 hours, 26 hours. We started at 9
No, skipped church for time, and whole Sunday we have been behind this. Thank you, Dr. Javi, for that huge session on caries, and now this small session by me. And candidates, hats off, especially people like Tina, hats off. That's all I can say. Thank you very much.
Blossom still there. She's from the morning. She's
Dr. Blossom, all the way from morning. Yeah, perfect. Perfect. Thank you all once again. And good night. Dr. Jobby, good night.
Good night. Good night. Good night.